A patient today asked about NMS, or Neuroleptic Malignant Syndrome. NMS is a potentially serious and potentially fatal neurological emergency that can happen to patients taking antipsychotic medications. With that being said, I have never seen it in outpatient psychiatry, and I've seen one case in inpatient work where a patient was on multiple neuroleptics at high doses due to a history of severe psychosis and violence. And so while it's important for people to know about this, and while this is going to be listed on your package inserts for any antipsychotic medication, it is important that patients know that this is a rare condition for individuals taking typical doses of these medications. And if you have concerns about this condition, you want to talk to a medical professional immediately or talk to your mental health provider immediately, as opposed to making changes with your medications or not taking medications that could potentially be very helpful for you. So NMS typically presents with mental status changes for patients. So when providers out there or students out there, if you're taking your boards for internal medicine or psychiatry, the triad that you look for, it's first mental status changes, and the mental status changes tend to be more like an agitated delirium than psychosis that you see in something like schizophrenia. So altered mental status is number one, that looks like an agitated delirium typically. Number two would be rigidity. Rigidity is severe and it is generalized. And so it has been described as lead pipe rigidity, meaning that if you, let's say you take someone's arm and you move it, you're going to feel like you are moving a lead pipe throughout that entire range of motion. Just to give you an idea of how severe this rigidity can be. So you've got 82% of the time, the first thing that happens is your mental status changes, then rigidity, and then after that, hyperthermia. And we're not talking about just slight increases in temperature. Now that certainly can occur, but typically the temperatures for an individual with NMS would be at least 100.4 to 104 degrees. So you're looking at significant fevers for these individuals. So that's the triad, the three things that you're often asked about on board tests. And then those three symptoms can lead to number four, which is your dysautonomia. And dysautonomia is what can lead to death from NMS, and Neuroleptic Malignant Syndrome. 88% of the time, that dysautonomia is tachycardia, but you also see very labile blood pressures. So in general, the individual's blood pressure will be higher than normal, but it will be labile. So think about ups and downs with spikes in someone's blood pressure that can get very high. That certainly can be very dangerous, and all that could lead to dysrhythmias and could lead to death. In terms of treatment of NMS, or Neuroleptic Malignant Syndrome, it's highly supportive. And so let's say that an individual has a very high fever and is very rigid in terms of all the skeletal muscles in their throughout their body. They're likely going to need IV fluids. They're likely going to have elevated CK. And so you'll see CKs typically above 1,000 international units per liter, but they can extend up to 100,000 international units per liter. Obviously, the higher someone's temperature and the more rigidity and the longer this is all going on, the higher the CK is going to be. And that can certainly lead to kidney failure if you're not giving supportive care, IV fluids, and really trying to decrease that rigidity and those temperatures. You can additionally give dantrolene, or skeletal muscle relaxer, to try to decrease that rigidity, decrease that tone, and help them with some of these symptoms. You're going to want to monitor closely their vitals to make sure that you're addressing any tachycardia, that you're addressing any fluctuations in blood pressure as well. So thoughts are that NMS is caused from, we don't know exactly why it's caused, but we know that dopamine blockade is likely implicated because all the medications that tend to cause it cause dopamine blockade. And there's some thought that centrally acting dopamine blockade in the hypothalamus can in particular lead to changes in someone's temperature and dysautonomia. And so it's likely that dopamine blockade in that region is implicated in the development of NMS. NMS can also be seen in Parkinson's disease when someone is in withdrawal of L-dopa, which are dopamine agonists as well. Again, if this is I know this is a rather complicated video, and it can be a scary and concerning video for individuals out there, but I do want to just give a broad picture. And again, if anyone out there has concerns that this is something that may be applicable to them, you want to seek immediate medical attention. Finally, NMS is something that takes a while to resolve. And so an individual typically, typically resolves in about 7 to 11 days. So someone's going to be likely admitted to an ICU and in the hospital for a couple of weeks if they develop NMS. And in terms of restarting any antipsychotic medications, in general, the recommendation is going to be to not restart antipsychotic medications. However, benefits and risks need to always be looked at. And so if someone has severe illness that only responds to antipsychotics, it certainly is possible to consider restarting an antipsychotic, but because this condition is so severe, you have to really be careful about doing so, and providers are likely going to want to collaborate and discuss cases and really figure out other things that they can do in terms of the treatment of these individuals. NMS can occur after even one dose of a medication, and it can also occur after an individual is on a medication for years at the same dose. It can happen at any time, which is also a little bit concerning with this illness. All right, thank you for watching. Again, this video is meant to be informative only, not medical advice for anyone out there.